A guide to restorative dentistry. Restorative dentistry repairs diseased or damaged teeth to their proper form and function. For example, missing teeth can be replaced with a dental crown supported by a dental implant, helping patients to reestablish proper chewing function to obtain good nutrition and a beautiful smile. What are the benefits of restorative dentistry? Restorative dentistry can be highly beneficial. Here are a few reasons why. Treat infection. One of the most common causes of damage to teeth is infection from tooth decay and cavities. Without intervention, these infections spread. Restorative treatments like dental fillings remove the diseased tooth structure and replace it so the infection will no longer progress. Restore chewing function. Damaged teeth can be painful to chew with, causing people to alter their diet or eat abnormally. Dental implant-supported crowns, dentures, or bridges are all options to restore the chewing function of the tooth. Improve smile appearance. Missing and broken teeth can be visually unpleasant. When someone undergoes treatment to restore or replace missing teeth, it also improves the aesthetic appearance of the smile. Restorative dentistry may be your path to great oral health and function. The mouth is the gateway to the body, and you cannot be completely healthy unless your mouth is healthy. Many dental problems are chronic or can become progressively worse, leading to serious issues. Poor oral health can cause an inability to obtain proper nutrition and is evidenced to show an increased risk for diseases like stroke, heart attack, diabetes, and dementia. Your next steps. Restorative dentistry includes a range of procedures that can improve your oral health and function. If your last dental visit was more than a year ago, it is time to schedule an evaluation to learn if you may be in need of restorative treatment to improve your quality of life.